So of course it could be both. Having tested the glenohumeral ligaments, the coracohumeral ligaments and the transverse humeral, we can look at articular stability of the joint. And I think probably what you're testing here is the integrity of the glenoid labrum. And we can do this in sitting. So we'll have the patient sit up for me, come to the edge of the bed. Thanks. Now this is going to be very similar to the test that we did for the inferior and middle bands of the glenohumeral ligament. But instead of putting it into the position and then applying the stress, we'll actually be taking it into the position and feeling how it goes into that position, whether it moves in there smoothly or whether you feel it sublux into it. So for this, we'll apply our thumb to the back of the humeral head, there. And grabbing hold of the wrist, we'll bring the arm up into an abducted position and then extend. So as I pull back on the arm, it laterally rotates and extends. As I do so, I'll push with my thumb on the humeral head and feel to see whether it's slipping forwards. Now, make sure you don't do this on a shoulder where you already know that there is glenohumeral instability, because there's a good chance you can dislocate the shoulder this way. So it should only be done when the humeral ligaments are stable. And this click is an indication of an articular instability, which is probably due to the glenoid labrum. The other test we need to do is a posterior stress test for this, for the joint itself. And we can do that in this manner. If I just swing you around this way a little, that's great. So I'll apply my hand to the back of the scapula. I'm right on the spine of the scapula, like so. And my other hand, which I'll show you in another shot in a second, see where we're going, will be on the anterior aspect of the humerus. And then all I do is shear the two bones on each other without going along the plane of the joint. Just push it straight dorsally and feel whether or not you can feel the humeral head slipping backwards. If I swing around into this position, then I can show you what it looks like on the front. The posterior hand will still be on the scapula, while the anterior hand will come onto the humerus, right onto the front of the humerus there, so that I can then just shear these two bones on each other, like so. And as I say, I wouldn't worry about stabilizing one bone and trying to shear the other. Keep your arms perpendicular to the shoulder joint and just push against each other. Okay.